Gastric banding is actually not a new concept. There have been bands done in the past, but they were permanent bands. This is going to be an adjustable band, which may or may not be removed. So I'll use this model to show you what a band looks like. First of all, the gastric band is what we call a restrictive procedure. That means that the primary method behind the weight loss is restricting the amount of food that you can eat and feel comfortable. The band is designed to create some restriction around the upper part of the stomach. And so when you eat a small amount of food, the food comes down into the top part of the stomach and then is restricted by the band and then ultimately passes through the stomach into the normal digestive channels, and you have normal absorption of the food. So the band is made of a silicone ring. There's a little balloon on the inner cuff of the band, and perhaps I can show that easier with a model here. This is an example of a lap band, and it shows that there's a central ring which goes around the upper part of the stomach, and there's a balloon on the inner part of that ring which holds the saline solution. The more saline we put into that balloon, the tighter the band, and that would typically go around the stomach up here, and then the port would be sewn here to the abdominal muscles, just under the left rib cage. You can't see that port from the outside. It's underneath the skin, but it is fixed in its position to the abdominal muscles. We can add or even take away some fluid, thus making the band either tighter or looser. The more fluid we put in, the tighter the band. Now, ideally, the band is tight enough to allow you to swallow your food comfortably and eat about a 4 to 6 ounce portion of food. And that would satisfy you for about 4 or 5 hours before then going on to your next meal. If the band is too tight, then the food doesn't go down well and it's not very comfortable. But if the band's too loose, then you're not going to get the weight loss results that you desire. So in general, we see about 50% excess weight loss with the band at approximately 1 to 2 years post-surgery. A typical band patient would lose somewhere between 10 and 15 pounds the first month after surgery, and then 3 to 5 pounds for the next several months, and so on. Some months you may not lose weight, you may stabilize. Other months you may have a great month and lose 5 or 10 pounds or more. So there is quite a variety of results with the lap band. Some people lose close to 100% of their excess body weight. Some people lose maybe 10 or 20%. It really does depend to get the maximum weight loss from the band on how well you follow the dietary guidelines and how well the band's being adjusted. It is reversible. Of all the surgeries that we do, it is the most reversible, so that if there were a complication with it or a problem, it could be removed. It would require a surgery to remove it, but that sometimes people find that attractive as far as being able to have it taken off if they want to have that option in the future. Other complications you can see with the band might include difficulty swallowing if the band is too tight, or if there's a band slip, and that could require surgery to fix that problem.